Good morning. I remain Dr. Ike Umebolu. We are going to continue our lecture series in pharmacology. Today we are going to talk about generic and brand name drugs. Brand name and generic names must be unique to prevent one drug being mistaken for another when drugs are prescribed. Generic names are usually more complicated than their brand name equivalents, counterparts. Brand names are usually catchy, often related to the drug's intended use, and easier to remember. Brand name Brand names. A brand name is a drug that is patented and sold by one manufacturer. The brand name is developed by the company requesting approval for the drug and identifies it as the exclusive property of that company. A manufacturer of a brand name can make that drug without any competition. When a company brings a new drug into the market, it has spent substantial amount of money on research, development, and marketing of the drug. A patent is granted that gives the company that developed the drug an exclusive right to sell the drug as long as the patent is in effect. Example of a An example of a brand name is Flagyl. Flagyl is the trademark of the drug, although its generic name is metronidazole. Brand name drug is the first version of a drug to be sold within a country. It is sold by the drug manufacturer that researched and developed the drug. Brand name drugs are more expensive because of the large investments brand name manufacturers make in marketing, branding, research, and development. These investments increase the prices by 30 to 40%. Let's talk about generic drugs. When a patent is nearing expiration, manufacturers can apply to the drug regulatory agency such as NAFDAC in Nigeria and FDA in the USA for permission to make and sell generic versions of the drug. Generic drugs are copies of brand name drugs that have exactly the same dosage, intended use, effects, side effects, route of administration, risk, risks, safety, and strength as the original drug. Their effect on the body, their effects on the body are exactly the same as those of their brand name counterparts. The regulatory agency requires that generic drugs be as effective as brand name drugs and that those generic drugs contain the same active ingredients as their brand name counterparts. Generic drug manufacturers are allowed to have different ingredients, inactive ingredients, such as dyes, fillers, flavors, and coatings. All these may be different, so generic drugs often look different from the brand name counterpart. Generic drugs are less expensive because the manufacturers have not the expenses of developing and marketing a new drug. When multiple companies begin to produce and sell a drug, the competition among them can also drive the price down even further. In a nutshell, generic drugs are those where the original patent has expired, which may not be produced by manufacturers other than the innovator company. The WHO defines generic drug to mean a pharmaceutical product which is usually intended to be interchanged with an innovator product, which is manufactured without a license from the innovator company and which is marketed after the expiry date of the patent or other exclusive rights. Generic drugs are usually produced at cheaper rates. So, among the aims of producing generic drugs is to provide a substantial amount of cost saving to the ever increasing cost of pharmaceuticals to the healthcare industry. Thus, it can be said that a generic drug is a Lego copy of a brand name. Generic drugs have different ingredients such as flavor or preservatives. Generic drugs manufacturers do not invest in research and development, marketing or branding the same way brand name manufacturers do. Without normal marketing and research and development expenses, the generic drugs cost is 30 to 40% lower. Similarities between brand and generic drugs. Brand name and generic drugs are similar in a number of ways. These similarities include that they both have the same active ingredients. They both have the same amount of active ingredients. They both work the same way in the body, and they are both absorbed by the body at the same rate. Some examples of brand name and their generic equivalents include Vibramycin is a brand name. Its generic equivalent is doxycycline. Advil is a brand name. Its generic equivalent is ibuprofen. Zovirax is a brand name. Its generic equivalent is acyclovir. Amaryl is a brand name. Its equivalent is glimepiride, and so on and so forth. The main difference between brand name and the generic drugs is the cost, because brand names drugs involve the cost of research, development, and marketing. They are usually more expensive than their generic counterparts. So, in summary, we can say that brand name drugs are the first names given to the drugs produced by the drug company. Generic drugs or generic equivalents come into being after the patent rights has expired. Any drug manufacturer can now manufacture this drug under any name. They both contain the same active ingredients, but usually have different inactive ingredients. Here ends our lecture. If you like this lecture, don't forget to click the like button and subscribe to my channel, please. Thank you.